In the last decade, patients have increasingly questioned the limits of conventional care. Many struggle with treatments that only manage symptoms rather than cure or prevent illness. People with chronic pain, autoimmune issues, or constant fatigue are often handed prescriptions without deeper investigation. Holistic medicine aims to close that gap. Practitioners look at root causes, diet, sleep, emotional health, or even social connections. They ask questions like, what's causing stress? Is this person sleeping well? Are relationships impacting health? These answers shape custom wellness plans. More doctors and nurses are training in lifestyle medicine, integrative nutrition, and stress management, says Dr. Johnson. Patients are seeing real results, less medication, better mood, more control over their lives. When we stop seeing people as symptoms and start seeing them as whole individuals, care becomes more effective. Technology enhances rather than replaces the holistic model. Wearables, health apps, and AI-based tools help track sleep, diet, exercise, and mood in real time. This data makes care more precise. Providers can notice hidden patterns and adjust treatment without guessing. Telemedicine expands access too. People in rural areas, or those too busy to travel, can now meet holistic providers through video. Messaging platforms allow patients to check in and receive updates between visits. It's responsive, continuous care that fits modern lives. And with more data being collected, holistic care is becoming more evidence-driven. As thousands of people track their habits and results, patterns become clear. Which diets reduce pain? What practices reduce stress? The future of holistic medicine will be built on these insights. Personalized, patient-led care and prevention. A central focus of the future is patient autonomy. Holistic medicine treats the patient as an active participant, not a passive recipient. This shift changes the role of practitioners. They become coaches and collaborators. Education is a key component. Instead of rigid protocols, providers teach people how to understand their bodies and make decisions based on awareness. Self-care and mindfulness aren't one-time techniques. They become lifelong tools. Nutrition advice is flexible, considering personal habits and cultural norms. Dr. Johnson notes, as testing becomes more advanced, we can personalize care even further. Genetic and microbiome data allow us to design tailored plans for nutrition, supplements, and physical activity that suit each person's biology. This means moving away from one-size-fits-all healthcare. Instead, every patient receives a kind of health roadmap made just for them. The focus shifts from reaction to prevention. Holistic care emphasizes daily choices, healthy meals, walking, good sleep, that lower disease risk. Lifestyle itself becomes medicine. Food, movement, sleep, and social ties all function as part of treatment. These factors combined can reduce the risk of chronic diseases like heart conditions or diabetes. And these routines don't just happen in clinics. They become part of normal life. Medical schools now teach the importance of lifestyle counseling, and insurance companies are beginning to reward preventive care. In time, we'll see more healthcare systems supporting not just the treatment of illness, but the building of lasting wellness, community, social connection, and education in holistic medicine. Holistic care values connection. Healing is harder in isolation. That's why future models will prioritize group visits, peer support programs, and wellness communities. People thrive in supportive environments. Programs that connect patients with others, whether through support groups or family-based care, boost emotional strength, reduce stress, and improve commitment to health goals. Public health will also leverage community power. Initiatives like walking clubs or community gardens bring people together around shared goals. Support turns information into action. As the field grows, practitioner training becomes more important. Licensing and certifications will tighten to ensure safe, skilled care. Future providers will need expertise in both conventional and holistic methods, knowing when to use technology, medicine, or lifestyle changes. Patients trust providers who are transparent, says Dr. Johnson. Clear communication, shared treatment plans, and open credentials create trust. That's essential for holistic healing. The global influence of holistic medicine is shaped by global traditions. Systems like Ayurveda, traditional Chinese medicine, and indigenous healing methods are influencing today's care models. As the world becomes more connected, modern medicine is learning from these time-honored systems. This integration creates care that is more flexible and inclusive. Collaborations between medical doctors and traditional healers are becoming more common, blending science with deep cultural wisdom. Ultimately, the future of holistic medicine centers on whole-person healing. It blends modern technology with ancient wisdom, science with empathy, and prevention with personalization. As health challenges grow more complex, holistic medicine offers a path forward, rooted in connection, understanding, and care that meets people where they are.